My name is Tanya Sook, and I am a nurse practitioner here at Renew, and I am here to talk about bioidentical hormone replacement therapy. Hormone replacement therapy is very specialized, and what we do is we offer bioidentical hormone replacement, which is multifaceted. We have multiple hormones. It's not just our sex hormones, it's our thyroid hormones. It's insulin resistant, it's gut health. We look at all of those here at Renew Aesthetics and individualize patients' treatments based on what we see as far as lab findings go, and incorporate functional medicine approach to make people feel amazing and not just replace sex hormones. This actually happened to me where I went to almost four different doctors for hitting menopause abruptly. You hurt, you ache, your energy goes low, you don't feel like doing your daily activities. There's so much that can happen to men and women, and it actually puts us at more risk of heart disease, stroke, diabetes, and multiple other aspects. If you're going and you don't feel good and you've seen multiple other physicians and they say all your labs are normal, well, the ones they are checking might be normal, but the ones that we are checking might need some adjustments. I look at them in a different light. I look at optimal ranges of labs and not large ranges of lab findings. We do topical replacement, whether that be patch or topical that they're applying on the skin, or pellet therapy, because research is showing that that has the least risk to the patient, and patients feel amazing because that's naturally what they have in their body. So if you have any additional questions, please go to our website and fill out our virtual consultation, and we will be happy to answer all your questions and specialize your treatment for you.